Hello, congratulations on the birth of your new baby. My name is Tabby Erlinson and I'm here to do an assessment on your baby if that's okay. Great. So this baby girl was born at 40 weeks and 0-day gestation. Mom had an uncomplicated pregnancy, an uncomplicated labor and birth, and we are going to do a full head to toe assessment. So we are gonna start by just looking at baby. Mom had just got done nursing. So right now she is calm. She is kind of sleepy awake, but still awake. And she is nice and content. She's very relaxed, but in her arms and her legs are slightly flexed. And she is nice and warm. She has no increased work of breathing, so no retractions, no nasal flaring or grunting. And I do not see any lesions just by doing an overview on her like this. I can see that her skin is intact and she is pink all throughout, even her hands and her feet. And even if she wasn't pink in the hands and feet, that would still be okay because acrocyanosis is normal in the first day or so. As circulation changes to that extrauterine life. And then we're going to do the Moro reflex. So I'm just going to pick up baby and kind of put her down, and then she'll kind of go like what she did. So that was good. And then we're going to look at her head. And just by inspecting her hair, I can see that she's got normal distribution of what little hair she does have. And I do not see any skin breakdown lesions. And she's got normal color all throughout. And I do not see any caput or molding or bruising on her head, so no cephalhematoma. And then I'm going to palpate her skull. So babies have these little soft spots here. This is the anterior fontanelle, and then this is the posterior fontanelle. And then these are suture lines. This allows for their head to fit down the birth canal. And we like that the fontanelles are soft and flat, the front more so than the back. The back you can barely feel, but it's still there. And the suture lines are nice and approximated. They're not overlapping and there's not big gaps in between. And so this one is the coronal suture line, this is the sagittal, lambdoidal, and then this is the metopic suture. So that looks good. And I am assessing cranial nerve 7 by looking at her face symmetry. It is equal on both sides. And then I am looking at her eyes next, and I see that the palpable fissures are horizontal. There's no slant upward or downward, and there's an appropriate amount of space in between her eyes. And then I'm going to use a little light here to assess her pupillary response, which is cranial nerve 2, and it constricts nicely to light on both sides. I'm going to use an ophthalmoscope to assess the red reflex, which is present and symmetric on both sides. And then after that, we're going to go to the ears. I'm looking at the pinna. There's nice roundness to it. There's lots of creases here in the crus, and there's no pits, sinuses, or skin tags present on the pinna or on the tragus, so that is good. I'm looking on both sides. I'm going to assess the pinna recoil, which is good. And then I'm going to look at her nose. So her nose is midline, and it's also the septum is midline. The nares are patent because we can hear that she's breathing and she's not making noisy breathing. And if I was concerned for nair patency, I would use a French catheter to go down her nares. Also, going back to the ears, I can see that they're nice in line with her eyes here, and that there's no slant toward for them either. And it's like that on both sides. So assessing cranial nerve 12, looking at her tongue movement. And cranial nerve 5, we know that she had by looking at rooting. We knew she was sucking at the breast, but I'm going to assess it with a gloved finger, which is nice and strong. Way to go, baby girl. And then I'm going to assess her soften her palate. So just looking at her mouth, I can see that her mucosa is pink and intact, and it's moist. And then I'm going to just feel the hard and soft palate, and it's intact. There's no clefts present. I knew that when she was crying earlier, I could see the movement of the uvula, which is cranial nerve 9. And I know she was swallowing at the breast when she was feeding, so that is excellent. That's cranial nerve 10. And I knew that she has a nice strong suck, so that's great. And then just going down to the neck, I can see that there is no redundant skin, there's no webbing. I'm going to assess for masses, which I do not feel any, and the trachea is midline. I'm going down to the anterior chest. I am going to look at, I can see that her chest is flat and it's not concave or convex. I'm going to feel the clavicle here. It's smooth and intact. There's no crepitus, and I know that there was no complications for birth, so she did not get stuck in any way. And looking at her skin, it's intact. Looking at her areolas, there are only 2 nipples present, which is good, and they're symmetric. And I'm feeling little buds, which are present. And then I'm going to listen to breath sounds for a full minute. And babies can have periodic breathing. And I'm going to listen with a neonatal stethoscope here. I'm going to listen on both sides. We can say that we listen for a full minute, and then we would go on to listen to the heart sounds, and we're going to listen to both the diaphragm and the bell in all 5 areas, just like we would do with a grown-up. And so I'm listening to aortic, pulmonic, herbs, bicuspid, and mitral. And her heart rate is regular and it's nice and strong, and I don't hear any murmurs, but it would be normal if they did have one. And I would listen with the bell as well in those same spots also for a minute. Moving on, we're going to look at the upper extremities. And I can see that she moves her arms. They are symmetric. She has full range of motion with her elbows. I'm going to feel her humerus bilaterally. I'm looking at the palmar creases. There's multiple creases. There's not just one. She has good tone. There is no webbing in her hands, and she's got 5 fingers on each side. And we're going to elicit the palmar grasp, and she's able to squeeze my fingers, so that's excellent. And then I'm going to assess for the square window. And I'm going to just flex her hand down. And the fact that she's able to bring her fingers all the way down, and there's no square window present or it's like stuck here, that tells me she was term and ready to come out. And she's got good arm recoil, and I'm going to assess the scarf sign. So we're going to bring this arm across here. And the fact that she can't go all the way over and just kind of brings her elbow across her chest also is a good sign that she was term. And then I'm also going to feel the I'm also going to palpate the brachial pulses. which is present bilaterally. And then I'm going to look at her tummy. And just by looking at her tummy, I do not see any discoloration, lesions, or hernias present, especially by that umbilical cord stump. And it looks like it's drying and still clamped. So when it's dry, we'll take that clamp off. And then I'm going to listen to bowel sounds with the diaphragm. And she's got active bowel sounds all throughout. And then I'm going to do light and deep palpation to her tummy, starting here very lightly. I don't feel any masses, and we're going to go a little deeper this time. Good job, baby. No masses present. I'm also going to try to feel for her liver, and sometimes you can feel the edge of the liver in a normal newborn. I don't feel it on her, which is also okay. And then I'm going to assess the femoral pulses. So I'm going to just press here, and they are equal bilaterally. And then I'm going to assess her genitals. This is a little girl. Her labia majora is a little swollen. I don't see any discharge or bleeding, but that would be normal in a term baby girl because of extra hormones from mom. I'm also looking at the perineum. I'm just gonna spread the majora a little bit so I can look. And I don't see any lesions or skin tags. I'm also looking at her anus here, and I know that it's patent because she was passing stool already. So she's able to void and stool. So plumbing is working. And then I'm going to look at her lower extremities before I flip her to the back and assess her posterior thorax. And I know that she's able to move these legs bilaterally. And she's got good color all throughout her legs down to her toes. I can see that she has plantar creases on her legs, or on her feet. And there's no webbing present, and there's 5 toes on each side. And then I'm going to elicit the plantar grasp, which is when they curl their toes like this, kind of like the plantar grasp when they curl their fingers. And then I'm going to assess the Babinski reflex, where I just drag my finger on the outside and her toes go like this, which is present. And we're going to assess it on both sides, which is there. And her knees have good range of motion. And then I'm going to do the Alice sign. We're looking at the height of the knees. So I'm just bringing them up here, feet down, bent at knees, and they're equal height. And then I'm going to go heel to ear. And I have a lot of resistance with this, so that is good. Preterm babies kind of just go all the way. And I'm going to look at the popliteal angle, which is kind of like passive knee flexion. And it should be less than 90 degrees, which it is. Preterm babies have way more than that. So she is looking excellent here. I am going to do the Barlow's maneuver in the Ortolani to assess for hip dysplasia. So I'm going to just bring her legs up like this, bend at the knee, and kind of go inward, which is Barlow's. Push down, there's no clunk or dislocation heard. And then I'm going to go outward, abduction, which is Ortolani's. And same thing, no clunk or dislocation heard. And then I'm going to flip this baby to the back. And I'm looking at her spine. It looks like it's nice and straight. I'm going to run my finger down it. It's straight and aligned, and I see the gluteal folds are equal on both sides, so no concern with alignment issues. I'm going to listen with my stethoscope to listen to her lung sounds on the back. And we're listening with the diaphragm for a full minute, all the way down. And then I'm just going to assess for sacral dumping, which I do not see. And she looks perfect. Congratulations. Do you have any questions for me? Wonderful. I'm going to put a diaper back on her, swaddle her up, and that is it. Thank you.